Hi, welcome to the Neurometabolic video series. My name is Dr. Sean Price. I am the chiropractic physician and clinical director here at Chiro Spa here in Fort Walton Beach. In this video, I want to talk about iodine and how it relates to the thyroid gland. Now, as you can see, I'm going to go through some points here. But the general experience for most patients is if you walk into a health food store or if you go online and you look for any kind of research on, what can I do to support my thyroid gland? Especially if you have a hypothyroid, you're going to find iodine. Iodine is the key. Take iodine. You go into a health food store, they're going to recommend that you take supplementation that has iodine in it. If you go online again, they're going to recommend iodine. And I will agree that iodine is vitally important to thyroid function. But here's the problem. According to Dr. Karazian, he's the author and a well-known thyroid expert, and he's the author of the book, Why Do I Still Have Thyroid Symptoms Even Though My Lab Tests Are Normal? According to Dr. Karazian, when you take iodine with certain thyroid conditions, it's like throwing gas into a fire. So why is that? What happens? Well, basically, iodine is involved in the stimulation of the enzyme TPO in the thyroid gland. When you have an autoimmune thyroid, which is where your body is making antibodies that attack your thyroid gland, one of those antibodies that are made are TPO antibodies. In other words, they're antibodies that are designed to attack the TPO. Well, if you take iodine and that's causing an increase in the TPO production, and you have thyroid antibodies that are attacking that TPO, then by default what's going to happen is you're going to increase the level of antibodies. By increasing the level of antibodies, you're actually fueling this autoimmune condition. You're actually making it worse. And what will happen with this, a lot of times if you have that influx of those TPO antibodies and they attack the thyroid gland, they'll destroy enough thyroid tissue that you'll have what's called a thyroid dump. And then what will happen there is you'll have a dump of these hormones and the patient will experience symptoms of hyperthyroidism. So it's very, very important that people, especially when they kind of go, they're hypothyroid, but they have these moments where they have extreme anxiety or they have these heart palpitations or these symptoms of hyperthyroidism. Or even if they go and get lab work done and one time they're hypothyroid and the next time they're hyperthyroid based on the TSH levels, it could be that they're experiencing these thyroid dumps that could be happening, and that indicates that there's more damage being done to that gland. So it's very, very important to test, and these tests are not typically done. Again, typically if you go to the doctor and they're looking for thyroid function, they're going to run your TSH, they might run some T3 and T4 measurements, but they very, very rarely check for the thyroid antibodies. So you have to get the right tests done. This is critically important, and it's also important that you don't seek health advice from somebody who is not qualified. Now, I'm not saying that all health food store owners are not qualified. We have some very, very qualified ones, are very talented health food store owners in our area, but they may not know this information. So it's very important that you get the testing done. It's very important that when you ask questions of people that you make sure that they are well versed in what's going on, and it's very important that you get the right answers. Okay? As always, you cannot rebuild your health with one supplement, one diet, one magic pill, potion, or lotion, and one medication at a time. You can, however, rebuild your health if you learn what the cause of your problem is, if you develop a customized plan that's designed to fit yourself and your body and what your challenges are, and if you learn what decisions to make and you make those decisions daily, you can rebuild your health and you can reach those health goals. My name is Dr. Price. I hope you have a great day.